and welcome to the Allcome webinar. My name is Jessie Wilson, she, her pronouns, and I'm the 1115 Waiver Strategic Operations Director. Go to the next slide. So just some Zoom meeting tips for today. You have a couple methods for asking questions. You can use the chat to ask the question. We want this session to be interactive. We will be saving the chat for our learning purposes. If you want to ask a question verbally, feel free to raise your hand using the Zoom icon and we can call on you. Just want to note that the webinar is being recorded and it will be shared with participants after the presentation. And for live captioning, you can click on the CC button at the bottom of your screen. Okay, before we get into some of the details of one of the benefits we're launching, I wanted to share some background information on the 1115 Medicaid waiver, in case folks may not be familiar. So first of all, what is the Oregon Health Plan? It is essentially Oregon's Medicaid program. So Medicaid is the nation's public health care program, and in Oregon, we call it the Oregon Health Plan, or OHP, which you'll hear me refer to throughout the presentation. The Oregon Health Plan is free healthcare coverage for low-income children, teens, and adults who live in Oregon. You can apply for OHP at any time during the year. So what is a Medicaid waiver? So the Medicaid waiver allows states flexibility to change their Medicaid rules. States do need to follow federal rules in order to receive Medicaid funding. However, the Medicaid waiver, and specifically the 1115 Medicaid waiver, which we'll be talking about today, is a tool for states to use to try new programs, provide additional services that aren't typically covered, and temporarily change these Medicaid rules that they typically have to follow. And so the Medicaid waiver is essentially waiving requirements that states typically have to follow. And health-related social needs, or HRSNs, as you may hear me refer to throughout this presentation, are social and economic needs that affect people's ability to stay healthy and well. Eligible OHP members may apply and receive these services, and they are meant to help improve their health outcomes. And the 1115 Medicaid waiver, through our most recent application to CMS, we received authority to provide services to help support individuals, eligible individuals' health-related social needs. And so that turned into different benefits that we are able to offer during this waiver period. And those benefits include housing supports, so rent and utilities assistance. It also includes home changes for health and safety, so support with air conditioners, air filtration devices, as well as support with safety features in the home, like a wheelchair ramp or grab bars to help support individuals. Additional benefits also include nutrition supports, which we'll be covering in more detail later in this presentation, and then the outreach and engagement services, which are a variety of activities to help support members get connected to either Medicaid or non-Medicaid services that they may need. It's really like a case management benefit to support wraparound services for members. Next slide, please. Okay, so before we get into the specifics on the nutrition benefits, just to recap, Oregon has received approval through our 1115 Medicaid waiver from the federal government to offer those HRSN services. And one of those HRSN services is a nutrition benefit. And so we'll be diving in deeper on what those new benefits are going to look like this summer, specifically on pantry stocking and fruit and vegetable. Next slide, please. Okay, so the HRSN program currently offers a few uh, nutrition benefits that we've already launched. We launched a few of these on January 1st of 2025, you may be familiar with. One of them is medically tailored meals, which are prepared meals for up to 6 months that can be delivered to members with specific health related conditions. In addition to medically tailored meals, we also offer assessment for medically tailored meals to see if an individual would qualify. So, this assessment does need to be with a registered dietitian nutritionist or RDN, and they can help the member develop a nutrition care plan. We also currently offer nutrition education, which is a service that helps members understand how to choose healthy foods and beverages. And then launching here in just 2 weeks on July 1st, we're excited. We are going to be launching the pantry stocking benefit as well as the fruit and vegetable benefit. The pantry stocking benefit provides eligible members with a portion of their recommended daily food for up to 6 months. It can include fresh foods, frozen, dried, pureed, or canned. And then the fruit and vegetable benefit provides fruits, vegetables, and herbs to members for up to 6 months. Fruits, vegetables, and herbs can be fresh, frozen, dried, pureed, or canned as well. And we're going to provide more information on these benefits in the upcoming slides. So let's start with pantry stocking. So this is meant to supplement an individual's daily food intake need, not completely cover the full need. It's intended to serve to cover about 80% of an eligible individual's daily nutrition needs. So just want to share that at the top. There are two different service models for how individuals may be able to receive this new benefit in July. They can receive a grocery box or potentially a card. It really depends on which options their health plan offers. So, not every health plan is going to offer a box and a card model, but every health plan will provide the service, the pantry stocking service. It just depends on which area of the state they're in and which model is available. But all eligible individuals will be able to receive the covered service for pantry stocking, which again includes an assortment of foods aimed at promoting improved nutrition for the member. Again, foods available through this service may be fresh, frozen, dried, pureed, or canned. And for certain health plans, they may be offering a grocery box model that can be delivered to the member, or the community supported agriculture program can support that option. Some members may also be able to receive this benefit through a card or a voucher that can be used only at the participating food retailers for allowable purchases. And again, there may be one or both of these options available depending on which part of the state the member resides and what the health plan offers. In terms of the benefit, it is an individual benefit. So it is not provided at the household level. So OHP members will need to apply and be authorized to receive the service at an individual level. It doesn't scale to the number of individuals in their household. However, that being said, other eligible individuals in the household may also apply and receive the benefit at the same time, or they can receive it at a different time. So just wanted to clarify, it is not scaled to the household level. It is an individual benefit. So the amount of food provided or the amount of funds placed on the card will be for the individual. The duration of the benefit is up to 24 weeks, and that can be across 26 weeks, so a 6-month period. So that 24 weeks represents the number of units that the member can receive. So 24 weeks worth of box delivery or 24 weeks worth of funds on the card to spend on the pantry stocking benefit. The 26-week timeframe provides a little bit of flexibility for the member if they wish to pause the service for a week or two for any reason. Example, member needs to be hospitalized, they need to pause the pantry stocking box. They have the option to do that for a couple weeks within that 6-month period. And in terms of setting, The box can be delivered to the member's home, private residence, or potentially picked up from a designated community pickup area. And then if they receive the card, they would be able to purchase from approved food retailers. Next slide, please. All right, the fruit and vegetable benefit, fairly similar to some of the details of the pantry stocking benefit. There will also be two different models for which this benefit can be offered, again, subject to what the member's health plan is able to provide in that service area. But some plans will be offering a box, others will be offering a card, and some will be offering both options. The covered service that the member will be entitled to includes fresh, frozen, dried, pureed, or canned fruits and vegetables, and herbs can also be included. The service model, again, box delivery or voucher, token, or prepaid card to be used at a participating food retailer. The unit, the eligible OHP members may receive this on an individual level, similar to pantry stocking. It is not scaled to the number of individuals living in the household, but multiple individuals in the same household could apply and receive this benefit at the same time if they're all eligible. And again, the duration, the same as pantry stocking, is up to 24 weeks across a 26-week or 6-month period. And the box could be delivered to the member's home, or there may be a community designated pickup area that the health plan has set up. And if the member has the fruit and vegetable card, they will be allowed to purchase approved food from participating card retailers. Let's go ahead and go to the next slide, please. Okay, in terms of eligibility for these new benefits, there are different layers to the eligibility criteria. To qualify for the nutrition benefits, first of all, the individual must be an Oregon Health Plan OHP member. There are additional requirements beyond that, though. Not everyone, unfortunately, on OHP will be eligible for the nutrition benefits. So the first layer after the OHP eligibility, the member does need to be experiencing a certain life situation. The next slide will cover more details on what a qualifying life situation is. Secondly, the member does need to have a qualifying health condition. That is one of the requirements from our federal partners, that HRSN benefits be tied specifically to qualifying health conditions and deemed medically appropriate. Third, the member has to have screen positive for low or very low food security. So they don't have enough food. They need to supplement with this benefit. And then finally, there may be additional service-specific requirements, which we'll get into later. This applies specifically to the pantry stocking benefit. Okay, next slide, please. Okay, so I mentioned qualifying life situations. There are several here on the slide, but essentially a member needs to meet one of these qualifying life situations, which are really represented as kind of transition-like periods in their life where they may be more vulnerable. So the first one is being an OHP member with a young adult with special healthcare needs, or YSHN is the acronym we use, YSHN benefits. Having left a mental health or substance use disorder treatment facility in the past 12 months, having left incarceration, such as jail or prison, in the past 12 months, being in the Oregon Child Welfare System, foster care now or in the past. If the member is going from Medicaid-only benefits to qualifying for both Medicaid and Medicare, experiencing homelessness, or at risk of becoming homeless. So the member needs to qualify for at least one of these life situations. Next, please. Okay, so let's talk about the qualifying health and social conditions. The health conditions are fairly broad, but members must meet at least one of the following. They need to have at least one of the following of this list: either a complex behavioral health need, a developmental disability need, a complex physical health need, difficulty with self-care or daily activities, experience with abuse or neglect, use emergency rooms or crisis services often, pregnant or gave birth in the past 12 months, child under 6 years of age, an adult who is 65 years of age or older, or have young adults with special health care needs OHP benefit. So that last bullet point is a covered population, as mentioned on the previous slide, but also serves as a qualifying health condition. And in terms of the social condition criteria on the right side of the screen, the member must be experiencing low food security or very low food security, which is determined by a 6-question screener that the health plan will utilize, and that helps determine the member's need. Next slide, please. Okay, finally, benefit-specific eligibility. So pantry stocking and fruit and vegetable benefit have a little bit different of eligibility criteria. The pantry stocking benefit is offered to a more narrow population. So in addition to the other criteria that I just walked through, to qualify for the pantry stocking benefit, members must be a child under 21, a young adult with special health care needs, or pregnant. Additionally, members must not reside in an institutional setting where they are provided with meals already. Fruit and vegetable benefit on the right, you'll see does not have that additional population criteria, so it serves a broader eligibility criteria, but it still has the same requirement that members must not reside in an institutional setting that already provides its residents with meals. Okay, so this slide is showing an example of what it might look like for someone to qualify for the benefits. This is just one example. There are various examples or scenarios where someone would qualify given the different life situations, the different qualifying health conditions. But this shows kind of how a member would screen positive for being eligible for this benefit. So again, they are on OHP. That's the number one eligibility criteria. And then from there, the health plan will determine whether they meet the other eligibility criteria on the screen. So the first one, life situation. So the member is experiencing a certain life situation. In our example, we included the member is a child that has an open case with child welfare in Oregon. So that would meet the life situation criteria. Secondly,
what kind of generation are you asking about?
The second, my Alexa went off there for a second. The second,
sounds like you had a tech hiccup.
There we go. The second is a qualifying health condition. I must have said something that they caught there. Okay, second is qualifying health condition. So this is, again, a broad list of qualifying criteria. In this example, we use the member has been diagnosed with lupus. So the member would then meet that criteria. The third is a qualifying social condition. So again, the health plan would screen the member for food insecurity. And it's basically a 6-question screener tool that allows the health plan to assess the member does not have enough food to eat. The member is essentially self-attesting to those questions. And so if they have let their health plan know they do not have enough food to eat, then they would meet that qualifying social condition. And then if there is benefit-specific eligibility required, which there is for pantry stocking, the member must meet that additional population criteria. So for this example, the member is a child under 5. So they would qualify for both pantry stocking or fruit and vegetable benefits. But I do want to share that they cannot receive both of the benefits at the same time. Even though they would qualify for both, they would need to pick which one that they want. And then, so say they start with pantry stocking and they receive the 6 months of pantry stocking, they could reapply after that for the fruit and vegetable benefit and receive that for 6 months, but they just cannot receive them at the same time. Next slide, please. Okay, I think I'll pause there before we pivot to our HRSN data update. And if there are any questions that we need to pause and cover, let's do that at this time. Looks like there was a question on the qualifying life situations with which Charissa has put in the chat. Patricia, thank you for the question. The boxes would be delivered on a weekly basis. Members could also elect to receive them on a biweekly basis if the provider is able to meet that need. But typically boxes would be delivered once a week. Thanks for that question. And thanks for the follow-up. Who delivers? So the member's health plan will work with HRSN nutrition providers who will deliver the box. Okay, well, please let me know if there are additional nutrition-related questions, and we'll continue to answer those in the chat as we see those come in. But for now, I'm going to turn it over to my colleague, Anna, to provide the data update. Thanks, folks.
Thanks, Jessie. Hi, everyone. My name is Anna Menon. I use she, her pronouns, and I am the HRSN Analytics Lead at OHA. You can go to the next slide. So I have a few data updates that I'll be walking you through and showing you our HRSN dashboard. But first, I'm going to introduce you to the team at OHA that created the dashboard and that works with the data. It's called the Social Health Needs and Analytics Projects Team. We go by SHNAP for short, and we provide comprehensive data support for implementing the 1115 waiver. So some of our key responsibilities and projects include collecting HRSN-specific data from health plans, analyzing HRSN data for internal uses, publishing HRSN analytics for public use, like the dashboard, and supporting providers to better use the HRSN data they collect or sharing data that we collect with providers. So at the bottom of the slide, you'll find a link to our online data request form related to HRSN data. If you have questions or research questions, need help with data, you can put in a request there. For other HRSN data questions, you can contact the SHNAP team. And our email is just below the online data request form. It's the hrsn.data@oha.oregon.gov. Okay, we can move to the next slide. So as I said, I'm here to share about an available dashboard tool. But before I get into the dashboard details, I wanted to highlight some specific data that you can find in the tool. So on this slide, we're sharing that starting from program launch in March of 2024 through December of 2025, almost 25,000 OHP members have received at least one HRSN service. And these services are delivered directly from health plans, so coordinated care organizations and OpenCard, as well as over 130 HRSN providers. And I'm just going to call out, we'll be launching the new nutrition benefits, the fruit and veggie benefit and pantry stocking that Jessie was just talking about in July. So we look forward to tracking increased use of the HRSN nutrition services after those launch. We can go to the next slide. All right, so this slide is on providers. And we've seen 137 HRSN providers actively delivering HRSN benefits to members across the state. That map on the left there just shows the darker areas indicate more providers serving members. And we have providers in every single HRSN service area. So we have 22 home changes for health providers, 107 housing providers, 10 nutrition providers, which again, we expect to go up with the launch of the new benefits, and 102 outreach and engagement providers. Can go to the next slide. We are also tracking disability data in the dashboard. And a finding that we saw was that a majority of HRSN recipients report having one or more disabilities. So 53% to be exact. And just to put this in some context, that's compared to just under a quarter for overall OHP members who report having a disability. And I'm going to note that these data are self-reported by a member when they enroll in benefits or when they interact with a health system. Okay, next slide, please. All right, this slide is talking about housing specifically. I know it's a hot topic. So here, just talking about the housing HRSN benefit, we have seen over 10,000 members that have received housing services from the launch in November 2024 through December 2025. The top 3 housing benefits that we see being delivered are tenancy and support services, rent and utility payments, and utilities arrears. Almost 50% of housing recipients have a disability, with 31% reporting a self-care and independent living disability. And then moving over to the map on the right-hand side of the screen, we see that members in Wallowa and Josephine counties have the highest rate of housing benefit utilization when compared to the overall OHP enrollment population. All right, next slide, please. Okay, so I'm going to get into the dashboard demo now. And it's live, it's available, and you can all access it. There's a link on the slide. I will also put the link in the chat in a little bit. But in the course of this presentation, I'll walk you through and review what the dashboard will cover, what questions it can answer, and what questions it's really not appropriate for trying to use. Broadly, the dashboard covers 4 areas of HRSN data. Those are general HRSN eligibility, HRSN service utilization, member demographics, and HRSN service providers. And the dashboard will be updated quarterly with data from 2 quarters past. So that's to account for the time it takes Medicaid data to finalize. This means that we're currently showing data through the end of December, and we will very soon be updating through the end of March 2026. All right, next slide, thank you. Okay, so the dashboard can't answer every HRSN question. For example, it's really not appropriate for understanding HRSN benefits for specific members or tracking any live data. Additionally, the provider information is not suitable as a provider directory, and this means we don't expect members to use it to find a provider. And at this time, the dashboard does not include the following data. So it doesn't include any denials, appeals, or grievances. It doesn't include just months of rent because the unit of rent and utility payments is a little complicated. It doesn't include any spending or financial data, any service provider contact information or location. It doesn't include any health outcomes data for the members who receive HRSN benefits. And finally, it doesn't have any timeline data about HRSN services. So that would be like the timeline from request to service utilization. And go to the next page. There are, however, many questions that can be answered with the dashboard, and it's many options to filter data. Some examples are, who is receiving HRSN benefits in my region, which providers are serving which geographic areas, how has the HRSN benefit utilization changed over time, and what languages do HRSN recipients speak? Okay. So now I'm going to walk through pretty broadly the different tabs that are available. And so this is the first one, the About HRSN tab. And we start out super broad, just reminding users what HRSN services specifically are, which ones are available, how we categorize them in this tool. And we also take some time here to remind users that eligibility is complex. And in addition to the broad 4 eligibility requirements, there are some service-specific rules for eligibility. And we do that because the next tab is the Population Eligibility Estimates tab, which explores very broadly the different requirements a member needs to meet to be eligible. So this visual illustrates how with each requirement, the population that we estimate to be eligible gets smaller. And we just went through this with Jesse, going through the eligibility requirements for the new nutrition benefits, which I think you could appreciate are very specific. So I'm going to go through those on a broad level here. So to be eligible for HRSN in general, you have to be an OHP member. Then one would need to fall into the covered populations. So for example, being at risk of homelessness or released from incarceration or discharged from a behavioral health facility. Next, one would have to have a clinical risk factor or a qualifying health condition. And finally, one would need to have a social risk factor or any other benefit-specific criteria, like low food security. So clinical risk factors and social risk factor eligibility requirements differ for each HRSN service. And although there are a set 7 covered populations, some HRSN services are only available for certain covered populations. So in the dashboard, we keep this very general because of the complex and highly specific nature for each HRSN service. Okay, we can go to the next page. All right, next we have the Member Demographics tab, which looks at the demographic makeup of HRSN recipients. So here we have HRSN recipients' age, county of residence, race and ethnicity, language, disability, and gender and sex. So race, ethnicity, language, disability status, and gender data are RealD variables, which means they are self-reported. And RealD, just to remind you all, it's on the screen. It stands for race, ethnicity, language, and disability. And it's a certain way that Oregon collects demographic information. So I'm going to note on the left-hand side, you'll see some filter buttons, and you can filter the data by benefit type, specific service, and for other views, you can also filter by health plan and or county. I'm going to note, of course, that the more you filter, the more that we will need to suppress or hide the data to protect member confidentiality. And for that, you'll see numbers turn into an asterisk or a little star in place of the number, just to suppress any counts less than 10. And for some views, such as the race ethnicity tab and the disability status tab, you will have the option to choose between viewing some high-level data in a bar chart or more detailed information in a table. All right, we can go to the next page. Okay, next we have the benefits tab, where we look a little bit more at HRSN services and their trends over time. So the view here shows the count and percent of HRSN services being delivered, as well as the count of total unique members who have received any HRSN benefit. So you can filter this view by benefit type, health plan, and county. And I'm just going to note how services are defined here. So for tenancy and outreach and engagement services, a unit of service is 15 minutes of support, while for rent, 1 unit of service is a month of rent and/or a utility bill. And the trends over time view shows how HRSN services have been delivered over the course of the waiver, so you can track how the benefit is being utilized over time. We can also view how many members have received services over time if you want a member-specific view. And in the trends over time view, and we are adding that. I think that is meant to be an addition for this view as well, to be able to see members as well as services. Okay, we can go to the next slide. Okay, finally, we have the provider tab, which has 2 available views on it. We're looking at the second one right now. The first one shows providers enrolled and delivering services over time. So the growth of enrolled providers who have delivered one or more HRSN service from the beginning of the waiver through December of 2025. And then this view shows the provider service area, shows active providers and a map shaded based on the number of active providers in each county. So this is determined by where the member lives, who is being served, and not necessarily where the provider is located. And this view can also be filtered by plan, benefit, and county. And here you can click on a row in the table, and the map to the left will respond to show the data that you highlighted in the row. Can go to the next slide. Okay, so this is the first version of the HRSN dashboard. We are planning on updating data and potentially adding new features over time. We are also exploring being able to offer a Spanish language dashboard for users. We are super interested in feedback. We have a feedback survey linked in this slide. It's the same one that is also linked on the dashboard page. So if you use the dashboard and there's a feature you'd like to see, or any comment or feedback you'd like to share, we're really happy to receive it. And I think that's my last slide. So with that, I might turn it back to Jesse, or should I open it up for any questions on the data or the dashboard?
Yeah, thanks so much, Anna. That sounds great. Do folks have questions or comments? All right. Well, thank you. Getting some comments in the chat there. Appreciate that. Okay, well, if there aren't any additional questions, want to say thank you for coming to our webinar today. If you do have comments or questions you'd like to share with us, we have our email address there, the HRSN program email. We also have the phone number there. And then at the bottom of the screen, we have our webpage, which we will be updating very soon with those new nutrition updates and providing more information on how folks can apply for the benefits. Thank you, everyone. Appreciate your time today. Take care.